my name's Adrian Richards and I'm the Surgical Director of Aurora Clinics, and today I'm going to be talking about the treatment options for hyperhidrosis. I've explained in the previous video that hyperhidrosis is a condition which affects a significant amount of the population and really it causes excess sweating from the eccrine sweat glands, which produce the thin watery sweat. So the options for treatment range from antiperspirants to surgery, and I'm going to work through those from the simplest antiperspirants through to surgery. So the simplest option is antiperspirant. Antiperspirants differ from deodorants. Deodorants neutralise the odour from the armpit. Antiperspirants usually contain some form of aluminium chloride and actually stop the sweating. And the way they do this is the aluminium chloride crystals coat the skin, and then when the sweat glands sweat, they actually draw by osmosis the aluminium crystals into the sweat gland, and they form a plug which typically lasts about 24 hours until washed off, and this plug in the opening, the mouth of the sweat gland, actually prevents sweat escaping. These so normal deodorant should be used first, and an interesting point is you shouldn't just use deodorants in the morning, you should use them morning and evening, because remember we've got a 24-hour effect here, and it's beneficial to use them in the evening as well to really try and keep those sweat glands plugged off. So start off with the normal proprietary antiperspirants which you can buy over the counter. If that doesn't work, the thing to then go to is some of the aluminium chloride based stronger antiperspirants, and the best known of these in the UK is called dry chlor. So that's dry chlor, which you can discuss with your doctor, and that works well. The downside of it is it can be quite irritable on the skin, and some of my patients have mentioned that they have quite a lot of irritation on the skin. Certainly a good way to start. Okay, if that doesn't work for you, the next option is called Iontophoresis, and this is basically a technique normally used really for the hands and feet, and you can buy kits for this, but basically the hands and the feet are placed in a bowl of water, and an electrical current is passed across the water, and this, no one really knows how it works actually, but it does tend to block the sweat glands and can produce reduction in sweat. So very good for the hands, good for the feet, but not so good for the underarm area, because it's technically difficult to submerge that area in a bowl of water, as you'll understand. So Iontophoresis, good option if you're bothered by hands and feet hyperhidrosis. The next option, which is proved very, very successful, is Botox therapy. Now, Botox essentially blocks nerve fibres. So any nerve fibres which secrete acetylcholine as their neurotransmitters. So this is muscle fibres, so that's why Botox relaxes muscle, and also sweat glands, eccrine sweat glands are blocked. The nerve impulses from the glands, the abnormal nerve impulses, are blocked by the Botox injections. So this treatment typically lasts 6 months, slightly longer than the muscle activity, interestingly, and essentially stops the nerve impulses to the glands and reduces sweating during that time. And it's very good for the underarm area. It can be used on the hands, can be used on the feet, but these are very tender areas, much more tender than the underarm area, and injections in there are tender, so we need to give some form of nerve block or some sort of numbing cream for the treatment. The final solution, which is really a bit of a last gasp, which is surgical treatment, is called endoscopic sympathectomy, and it's a sympathetic nerves which cause innervation to the sweat glands. So vascular surgeons, these are surgeons who normally deal with blood vessels, can, in a technique using telescopes and small incisions, divide the nerve trunks which supply the impulses to the glands. This is a treatment, works very well, it is an operation, and is really normally reserved for very severe sweating, principally of the hands and arms. So if you've got very severe sweating of both areas, and really none of these other treatments are giving you a solution, you know, it is worth considering sympathectomy. So I hope that's clarified some of the treatment options for hyperhidrosis. If you suffer from this, if you'd like any more information about the treatment, please don't hesitate to contact us either via our website or via ringing us on our office number, which is 018 44 214 362. We'll be happy to discuss the options with you. Thank you.